Now to something that's got to do directly with your palate. What we consume, how we eat. The favorite samosa, jalebi at the canteen may soon come with a perhaps slide of guilt. Even a small cup of tea might carry a sugar warning. In a bid to tackle rising obesity and non-communicable diseases, the Union Health Ministry has directed government institutions to display oil and sugar warnings for everyday snacks, urging healthier choices. Now, this comes in the wake of the alarming data from the National Family Health Survey, which shows that 1 in 5 adults in urban areas are overweight. The move aims to promote healthier diets, reduce healthcare costs and improve overall well-being, inspired by Prime Minister Narendra Modi's Fit India campaign. Also, there is an alarming statistic, viewers. By the year 2050, if we go on the path that we are going on, nearly 45 crore of Bharat's people will be obese or overweight, second only to the United States. Now, this step aims to promote more active lifestyle across age groups and the country. Now, samosas and jalebis are high-calorie foods where people don't just eat one, but just one piece of these popular foods border the mandated daily intake of fat, salt and sugar for an adult. Now, one samosa is equal to 200 to 300 calories, of which the fat content is nearly 10 to 20 grams of saturated and trans fats. Carbohydrates are 20 to 30 grams, while sodium can range from 77 to 423 milligrams. One jalebi is 150 calories with 3.5 grams of saturated fat and trans fats, carbohydrates at 29 grams, but just one jalebi has 19 grams of sugar. The WHO advisory is to just have 25 grams of sugar in a whole day. So now this has brought to light the obesity alarm in our country. Bharat ranks third in the globe following the United States and China in the obesity index. Over 70% of Bharat's urban population is currently overweight. Nearly 8 crore Bharatiya are obese, with 1 crore aged between the ages of 5 and 19 itself. Now, obesity among children under the age 5 was 2.1% in 2015-2016 and rose to 3.4% in 2019-2021. So this is the COVID lockdown period that saw a sharp rise in obesity, with a lot of people who had lack of exercise at home and eating, and especially children. 20,000 weight loss surgeries have been reported in 2019 versus just 800 in 2009. Now, the alarming rise can be seen if we just compare 1990 with 2022. As per a Lancet study in 1990, 1.1 million men were obese. In 2022, it was 26 million. 2.4 million women were obese in 1990. In 2022, it was 44 million. And 0.2 million boys were obese in 1990. In 2022, it was 7.3 million. 0.2 million girls were obese in 1990, and in 2022, it was 5.2 million. So we have a serious problem at our hands. But let's get a move on here. And before we leave, it's not just a problem with our own health, but it's also got to do, let's share with you something which has got to do with national security and our own internal security. So there are various levels. We need to do something about how we eat, what we do. But along with that, there are some actions that are...
News18.com marches way ahead of the Times of India with 38% more users on native and social platforms. Network 18, the undisputed leader of news networks, way ahead of the Times.